Orders, gathered my materials. Knock knock. Man. Hi, my name is Laura Dillon. I'm going to be your nursing student today. I'm going to do a physical assessment on you. Is that okay? Hands. Could you please verify your name and date of birth for me?
6/12/96.
All right, perfect. Do you have any allergies?
No.
No? Okay. And I would raise your bed up to my working height. Make sure you're safe. Side nose up. Then I would check your level of consciousness. You're awake, you're oriented, your eyes are open, you're making eye contact, you're smiling, so your mood is good, your speech is good, you were talking to me clearly. Can you please squeeze my fingers? I'm just going to test your strength, your grip. Good job. Alright. Alright, can you push on my hands? Can you pull my hands? Alright. Your strength is bilateral, equal, and I'm just going to assess your nerves on your face really quick.
Okay.
Alright. You're going to either tell me it's sharp or dull. Close your eyes. Thank you.
Sharp. Dull. Sharp. Dull.
Perfect. Thank you. Okay, so by doing that, it tells me that she can feel on her face whether it was sharp or dull. Now I'm going to assess your nerves, which are your olfactory, your optic, your ocular motor, your trochlear, your trigeminal, your abductions, your facial, your acoustic, your glossopharyngeal, your vagus, accessory, and hypoglossal. So I'm going to do that. I'm going to start with your head. So could you please sit on the side of the bed for me? Yes. Thank you. Okay, so first off, I'm just going to inspect your head without touching. I'm going to make sure that your hygiene is good, make sure your hair looks healthy, see if I see any infestations, gray hair, alopecia. Then I would put my gloves on and palpate your head. So I'd make sure there was no lumps, bumps. Again, checking for infestations, lesions. And you feel good. Alright, so I take my gloves off, wash my hands, come back, then I'm going to assess your eyes. I'm going to assess your position and alignment, make sure they're symmetrical, and they are. Then I'm going to check your conjunctiva and sclera. Your sclera is clear, looks good. Conjunctiva is wet, moist, and pink. Okay, and let me check your eyelids. They look good, they look symmetrical. Can you follow my finger? And by doing this, I'm making sure that you can look at all areas. Just make sure you let me know if you have any pain. I'm going to get my scope out, and I'm going to check your fundus, okay? Alright, just look straight ahead. Looks good. Alright, looks nice and orange. And then I'm going to check your dilation. So can you please look at my shoulder? Alright, good. Alright, when was your last eye exam?
2 months ago.
Okay, perfect. So I wouldn't have to do any further examinations. Just let me know, do you have glasses or contacts?
I wear glasses.
Okay, so your pupils were equal and they dilated equally. So moving on, we're going to check your ears. First off, I'm going to check, inspect, palpate your auricle. So, looks good. Looks good. Alright. Are you having any pain in your ears? No? Okay. Let me just check. I'm going to look with my otoscope at your tympanic membrane. I'll pull your ear a little bit. Looks good. Looks nice and orange. Not orange. Gray. And there's not much wax buildup, so that's good. Now I'm going to do a whisper test. Okay?
Pickle. Cereal.
Good job. Okay, so that's telling me that your ears are nice and clear. You're not having any problems with them. Next, I'm going to move on to your nose. First, I'm going to make sure it's symmetrical. Looks good. Are you having any congestion? Can you breathe out of one nostril for me? And now the other. Good job. I'm going to do a smell test on you, okay?
Okay.
Can you please close your eyes? All right. Just tell me when you can smell it and what it is.
Chocolate.
Good job. Okay. So next I am going to inspect your frontal, ethmoid, maxillary, and maxillary sinuses, okay? I'm just going to palpate a little bit. Do you have any tenderness, any soreness?
Nope.
All right, nothing feels swollen. That's good. Next I'm going to move on to your mouth. So your mouth looks symmetrical, your lips look good, nice and moist and not chapped. Can you open your mouth for me? Okay. Just gonna look inside. It looks pink and moist, nothing red, no tonsils. Can you wiggle your tongue around a little bit? Alright, and your gums looked good, your teeth look good. How often do you brush your teeth?
2 times a day.
Good. When was your last oral exam?
About a month ago.
Okay, good. Could you just swallow for me? Okay, good job. Alright, now I'm going to move on to your neck. I'm going to check your lymph nodes and your thyroid. So I'm just going to palpate. Are you having any soreness or tenderness? Good. Alright, can you shrug your shoulders? Good job. Alright, now I'm going to move on to your skin. So what I'm looking for on your skin is the appearance. Make sure you don't have any lesions. Making sure it's a good temperature. I would check your legs. Make sure there's no edema. Capillary refill on your toes, on your fingers. And I'm looking to see if you have any clubbing. I look at your axilla. Okay, and I'm making sure you have good hygiene overall. I look at your turgor, your vascularity. So then now I'm going to move on to your lungs. Could you just stand up for me? Okay. Alright, so for your lungs, I'm not going to put this around my neck, my ears, I mean, so I can talk to you. Okay? So first off, I'm just going to check for your adventitious breathing sounds. I'm going to make sure there's no crackling, no rhonchi, no wheezes. Okay? Alright. I'm going to check your bronchioles. Bronchial. 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 Right, bronchial vesicular. Bronchial vesicular. Right, could you lift yourself up a little bit? Thank you. Bronchial vesicular. Bronchial vesicular. Vesicular. And, whoops. Vesicular. Alright, sounds good. Now I'm going to do your back. You turn around. Alright. Bronchial. Just take deep breaths. Bronchial. 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 Bronchial vesicular. Bronchial vesicular. Bronchial vesicular. Bronchial vesicular. Vesicular. And vesicular. Alright, good job. Alright, so now I'm going to put my hands on your back. And I'm going to have you say 99.
99. 99. 99.
Alright, perfect. Now I'm going to listen to it, okay?
Okay.
That was just listening, feeling for the vibrations.
99. 99. 99. 99. 99.
Okay, good job. Alright, now I'm going to check for excursion. Alright, could you just take a deep breath for me? Good job. Okay, so now I'm going to percuss your back. Making sure that there's residents there. Alright, good job. Do you have a smoking history?
No.
Okay. You can sit back down for me. Alright, so by doing that, I was inspecting your breathing. I was inspecting your symmetry of your chest, making sure it was symmetrical. Do you have a cough?
Nope.
No? Okay, perfect. Do you have any shortness of breath? No? Do you have a history of smoking? No. Perfect. Okay, so now I'm going to move on to your heart. Can I just have you lay out on your back? I'll just uncover you where I need you, okay? So first off, I am going to check your aortic. Second intercostal space, right sternal border, which is where your S2 is heard. Alright, move over to your pulmonic, which is your second intercostal space, left sternal border. Move down to your Erb's point, which is your third intercostal space, left sternal border. Move down to your tricuspid, which is your fourth intercostal space, left sternal border. And move down to your mitral, which is your fifth intercostal space, mid-clavicular line, which is where the S1 is heard. And your apical pulse is the loudest, and it's also your PMI. Okay, good. Alright, now I'm going to move on to your pulses. Don't flash me here. Alright, so I'm going to start with your temporal. That's good. Alright, your carotid. Good. Good. Alright, now I'm just going to listen to your carotid so I can see if I can hear any bruits. Nope, it's clear. Clear. Alright. Now I've already checked your apical, so I'm going to move down to your brachial. Okay. Do your radial. Good. Your ulnar. Good. I'm just going to uncover your bottom half. Do your femoral. Your popliteal. Your posterior tibial. And your dorsalis pedis. Okay. And they're all there and present. Alright, so I'm all done. Do you need anything?
No.
Okay. So I would put your bed down, raise your rails up, give you your call bell. Alright, I'll come back and see you in a bit.
Okay.
Alright. Wash my hands and document.